Rhinoplasty, or as everyone calls it, a nose job, corrects the form and aesthetically changes the nose. Really, anyone is a candidate for this cosmetic surgery as long as the nose has matured. In Hollywood, we've seen lots of good noses like Halle Berry and Blake Lively.
Small changes can make a big impact, okay? So you have to do your homework in finding out who is experienced, who is properly trained to do it, and the best way is to ask questions.
We've also seen some really bad nose jobs too.
Michael Jackson, who's had over 20 noses done, that would be hard correction, and that's why after a while, his nose kind of melted away because there's not enough manipulating the tissues to go away.
Dr. Peter Chang of Timeless Plastic Surgery in Sugar Land is the only board-certified plastic surgeon in America with 2 Ivy League degrees, 2 doctorate degrees, and performed his first rhinoplasty in 1995.
When I look at the nose, it's easily explained by the nose is cut up in thirds. I'll show you from the skull model that the top third, they have a problem with the top third, is usually just bone. And the middle third is made of bone and cartilage. It's probably gone from the skull, but it's right about here. And then the lower third, which is basically made of a soft tissue. Once that problem's identified, then we kind of go into the aesthetics of what you want, what you need. Make it smaller, make it bigger, tweak here, tweak there.
It's truly a very artistic cosmetic procedure.
But not only do you have to know what a good-looking nose is in all aspects of it, you have to fit that nose to the individual. Some people have wider faces, tall faces, big eyes, big lips, small chin. So you have to match the nose to the person.
The nose needs to look natural and complement all the facial features. Dr. Chang shares some of his work by showing us some of his patients' before and after photos.
This patient has an upper third problem. She didn't like how her upper third of the bridge is flat. I reshaped it, did a rhinoplasty, augmentation rhinoplasty. I put an implant in there, okay? And I reshaped her nose, giving her a bridge, and kind of reshaped the bottom part as well to kind of match everything else and make it balanced. And this young patient, her main problem is the middle third here. She has this significant hump here, okay? And as you can see, the hump is gone after surgery. But this gentleman also has a middle third problem, where it's made of bony tissue here and cartilage tissue here, making this hump, okay? So he underwent rhinoplasty surgery where that hump is gone and the tip is fixed as well.
Dr. Chang mentioned some patients do require an implant, and here are several examples of what implants for the nose look like.
And
it's made of silicone.
Wow.
And it's shaped like the dorsum of the nose here, and that's the tip. And sometimes people just need a little bit of support here, like an L shape to kind of fit here. So it fits something like this. That's how another implant goes. And that's the tip of the nose right there.
Because in most cases, the bone in the nose has to be broken. The downtime can be up to 3 weeks with bruising and also swelling. Dr. Chang says if you're nervous about the surgery, some people are candidates for what's called a liquid nose job.
So if you have a depression on your nose and a hump, you kind of fill that depression out with the filler to kind of equal the hump. So it looks all smooth and even. So that can be done in like 15, 20 minutes or so. And some people do that because they're not ready for a permanent surgery, permanent rhinoplasty.